Hello, everybody. Welcome to Upstate CBD's Wellness Talks. So it's been a while since I've put one of these on. Just took a little break for the summertime, but now I'm back. And today I'm going to be discussing cannabis for epilepsy. So let me begin. So seizures and epilepsy are not the same thing. An epileptic seizure is a transient occurrence of signs and or symptoms due to abnormal, excessive, or synchronous neuronal activity in the brain. Epilepsy is a disease characterized by an enduring predisposition to generate epileptic seizures and the neurobiological, cognitive, physiological, and social consequences of the condition. Translation: a seizure is an event, and epilepsy is a disease involving recurrent unprovoked seizures. So a person is considered to have epilepsy if they meet any of the following conditions: at least 2 unprovoked seizures occurring greater than 24 hours apart, 1 unprovoked seizure and a probability of further seizures similar to the general recurrence risk, at least 60% after 2 unprovoked seizures, and the diagnosis of epilepsy syndrome. There are 65 million people around the world who have epilepsy and 3.4 million in the United States that have epilepsy. Approximately 1/3 of patients with epilepsy have seizures that are resistant to anti-epileptic medications. Moreover, there are many side effects associated with them, such as osteomalacia and anemia. The off-label use of cannabis sativa plant in treating seizures is known since the ancient times.
There is a prescription medicine out called Epidiolex, which is the first and only FDA-approved prescription cannabidiol. It is approved to treat seizures associated with Lennox-Gastaut syndrome, Dravet syndrome, or tuberous sclerosis complex in patients 1 year of age and older.
But what about the stuff that's retailed in stores like ours, Upstate CBD?
Endocannabinoids, cannabinoids synthesized normally within the central nervous system, have a role in decreasing the release of excitatory neurotransmitters in the CNS, hence preventing from seizures. They act on CB1 and CB2 receptors, with CB1 being expressed by central and peripheral neurons, while CB2 are mainly expressed by immune cells but are also found in the brain cells.
Thought of CB1 receptors being the only ones involved in neuronal activity regulation has been challenged by a recent experimental study on rats, which concluded that loss of both types of receptors will result in a spontaneous and more severe form of seizures than the loss of CB1 receptors alone. This formulates that the development of potential drugs enhancing that activity of these receptors could be used as a therapeutic means of seizure disorders, such as cannabis oil, which acts on both receptors. In a trial with more than 100 patient participants, the researchers observed a good anti-epileptic effect of CBD with few adverse effects, especially in participants with Dravet syndrome. Also, a randomized, controlled, double-blinded, multi-center study was done to appreciate the potential effects of CBD in controlling drop seizures in patients with Lennox-Gastaut syndrome. A total of 171 patients were randomly divided into a drug or placebo group in 1-to-1 pattern.
There was a 43.9% reduction of drop seizures in the CBD group of patients. Besides drop seizures, the frequency of other types of seizures was also reduced drastically, and which reflected a wide spectrum of effects of CBD in controlling different types of seizures. In many other studies compiled in a review, the median frequency of seizures decreased. There was a complete resolution of spasms and an improvement of illness in many child patients.
So as you could see within that last segment, the little boy was given cannabis oil and his seizure was managed, and within about 40 seconds, it looked to have calmed down the neural activity that was happening. So I'm not saying that cannabis can cure epilepsy by any means, but it can at least be used as another form of therapy for people that are experiencing some sort of epilepsy syndrome. It's worth a try. Talk to your doctors, physicians, see if Epidiolex is a option for you, it's worth it to just try these things. Cannabis has little to no adverse effects and can really work throughout the body and not just target a symptom. So I really just want to say thank you for tuning in. I appreciate whoever watches these if it interests you. If you have any questions, feel free to contact me at renata@upstatecbd.org. And then call us, talk to us. We're always here to provide information. Stay tuned for my next one on CBD for obesity. Have a good day.